Hello, my name is Michael, and I am the CEO of the RINJ Foundation, which is a global civil society NGO in consultative status with the United Nations. I'd like to talk to you about medical facts versus beliefs. I'd like to talk to you about medical science, including epidemiology and immunology, which is not a series of beliefs, but knowledge. And it's knowledge based on a very rigorous standard for testing, evaluating, and reaching conclusions, and then peer reviewing by people who basically do the same thing over in their own way and satisfy themselves that the original scientist with a theory and a conclusion and a so-called fact is indeed valid. So between beliefs and fact, scientific fact, there's a big difference. In Canada, vaccine mandates have been enforced since more than 100 years. In fact, in Europe, North America, in many parts of the world, of Asia, etc., Africa, vaccines have been enforced for a very, very long time, and they work. Now, people's theories on YouTube, Facebook, Twitter that are based on entertainment are beliefs. The danger here is that besides condemning all higher education, today's vast communication social media empires and their users may be people who are psychologically challenged attention seekers. Their communication is often outrageous and, well, just plain dangerously stupid, but it's allowed to proliferate by the large technical social media giants because that's what they do. What they do is they attract as many users as possible by the most, or with the most outrageous content in order to sell advertising on that content. And they make a fortune doing this. They're monsters. They're the largest corporations in the world. And they produce nothing. You give them their content. You. And so anyone can do that. It's a very, very powerful communication media. And it allows, like I said, it allows people who are psychologically challenged attention seekers to do whatever they want. And if they make it entertaining, a lot of people are going to watch. And that includes a lot of very credulous people who believe just about everything and anything they see on a screen. And that's become very dangerous. I frankly don't tolerate fools well, and that's been a problem all my life. And I don't tolerate these anti-vaxxer people. We've been over this. We've been over this for over 100 years. These anti-vaxxer people are goddamn liars because they have been vaccinated. They've been vaccinated for measles, pertussis, for smallpox, polio, etc., because it's required. You can't get up in the morning and walk to the store without having been vaccinated, because at some point in your life you had to go to kindergarten or preschool or grade 1, and you had to be vaccinated to do that. And there are many other things where you had to be vaccinated because that is a requirement for safe public health. People can't walk into a school with an AK-47, and they can't walk into the school with smallpox. That's the problem, get it? So without required vaccinations, you would not be alive. Vaccinations have ended smallpox, polio, tetanus, hepatitis B, hepatitis A, rubella, Hib, measles, pertussis, pneumococcal disease, rotavirus, mumps, chickenpox, diphtheria, and more. Look, by the time I was in grade 5, 3 of my friends had died of polio. It was a terrible, terrible disease. Most kids with polio then could not go to school. But by grade 8, there were no more cases because of the polio vaccine. The 1950s were instructional school years for that reason. It embedded in my brain that vaccinations worked because I saw it with my own eyes. Those poor children, those suffering children with polio, they were in braces, they were crutches, they were in wheelchairs. And they didn't have much hope. They kind of knew they were going to die eventually, and they did. So many people died of smallpox. Well, a vaccine eradicated smallpox. It eradicated many diseases, especially in North America, the rich countries in North America, where almost all infectious disease has been eradicated, but now there's a new one. It is a half-dead, half-alive mutt of a virus that's been around for 1 million years in bats. It's probably spread to other creatures, other mammals, and it has spread to humans, and we must vaccinate against this disease. Today, I am the CEO of an NGO in consultative status with the United Nations with over 4 million members, and I have visited medical units in all continents outside of Antarctica. In all this time, and in all this experience, meeting thousands of patients and their doctors and nurses working for our organization, the thing that I have learned that stands above everything else is that you cannot save the life of a person from an early death if they have not been fully immunized. So get vaccinated. It's going to require, I don't care what anyone else says, it's going to require at least 95% of the global population getting vaccinated to stop this mutt of a virus. And it is a mutt. It's just a rabid mutt that it will infect more and more people, and as it does so, the more it learns about the human body, the more it will mutate into something that is unstoppable using current fact, knowledge, capabilities. So, get vaccinated. Our organization forbids people to work in our clinics, our shelters, our birthing clinics, and so on, without having been vaccinated. The deadline was August 31st, and we mandated vaccines for everyone. Why? Because we want to prevent cross-contamination, cross-infection between medical workers and the public. Well, that's critical. That's what you expect. Well, everyone should do that. Vaccines must be mandated for the entire human race. You must get vaccinated. And by the way, you should be wearing an N95 mask because the Delta variant, the Mu variant, the Lambda variant, and new ones that are on their way are so infectious, and they're so small that they escape procedure masks, for example. They just pass right through a procedure mask because they're in the air, and people are breathing the air that others have breathed and without any protection. So you need a face filtering protective device like an N95 respirator. Get a respirator, wear it. You can wear it up to 5 or 6 times if you clean it well. And when I say clean it, I'm talking about putting it in the sunshine or using a UVC cleaner or something of that nature, or just throwing it out and wearing a new one. They're not that expensive. So wear an N95 and get vaccinated. And don't get COVID-19 because it's awful, and it's awful for everyone. Get vaccinated. Thanks for paying attention.